to item number 4, which is a briefing on the Black Men's Health Clinic. This briefing, we will be joined by Larry Wallace and Dr. Larry Wallace Jr. to share an organizational update. And we welcome you all to our Public Health Committee meeting.
Thank you, Madam Chair, and the council members. We appreciate the opportunity to come and give you an update. We were here about a year ago, and you acknowledged our work, and we still very much appreciate the support, and also the support that we've received through Austin Public Health, a huge partner in our efforts, and we just want to say thanks. We celebrated our 2-year anniversary a couple of weeks ago. And so as we look back over our 2 years of work, we've made tremendous progress. And so people ask why we do what we do. Next slide, please. People ask why we do what we do. We know that black and brown men have the highest rates of disparities. And among African American men, the leading causes of death are stroke, cancer, hypertension, all of those that really have a negative impact on men of color. And so the reason we do what we do is because we believe that our focused effort allows us to address these issues. And our mission is pretty straightforward, and our vision is pretty straightforward. We want to remove those barriers that exist that keep men from accessing care. There are many clinics in Austin and Travis County, but if you look at the number of men of color that access those services, it's really not at the same level of other folks. And so we took the time to understand why. And over 46% of black men have had negative experiences when they go to the doctor or engage the healthcare system. And so our goal is to really create pathways that are culturally appropriate, that will meet men where they are. And at the end of the day, the reason we do this work is to save lives. And as we lift up men, we lift up their families. And so that's the reason we do it. Our value statement is a life saved is another life that really can continue and contribute positively to society and to themselves. Next slide. Our 3 main focuses of work are in the space of mental health, and we've learned there's no greater need than mental health. And I'm happy through our partnerships that we have with Integral Care and Community Care, we have resources at our clinic, which is located at 6633 Highway 290, and the Black Men's Health Clinic in partnership with Community Care. Community Care is our clinical provider, and so as a result of that relationship, we're able to leverage those services. So they bring the clinical staff, the doctors, and the nurses. Our role is really ahead of all of that. We do the outreach, we do the engagement, we establish those trusted relationships in order for men to come into care. So our 3 pillars are mental health, and secondly, it's physical health. Health screenings are important, and we're really pushing hard in that space because early detection makes a difference. And with men of color, generally, there are conditions that people are not aware of and really have not been, let's say, conditioned to really take opportunity in advance to address what might be happening with your health. And then the third is social determinants. We can't ignore that. So in our work, we partner with people to help us address things like housing, food insecurity, transportation, economics, jobs. That's a whole body of work that has to be addressed as we employ our holistic approach to addressing the needs of men. I want to really emphasize the fact that we don't try to do what other people are doing. It's not our goal to duplicate, but it's really to fill that gap that exists. A core principle that we operate from is leverage. and collaboration. We don't need to be trying to move into spaces that are already there. We want to make those spaces more effective, especially when it comes to publicly funded agencies. And we believe we've done that. We connect with all the major organizations, with Central Health, Austin Public Health, and also Integral Care. Community Care is a huge partner, and we even go outside of Travis County in some cases. We're currently in the process of expanding our reach into Pflugerville, into Manor. We've had a conversation with the mayor in Elgin, and so the opportunities to go further with our work are present. I think the most important thing that we can do is establish a value proposition for our work, for people to understand what we do and what it brings to the table and why it's important and critical to continue this work. Next slide. Okay, so I'm going to turn this over to Dr. Wallace, who will talk about some of our outcomes and results and our structure and how we do our work.
Absolutely, appreciate it. Real quick before I go to the next slide, hopefully you have in your handouts our partners and collaborations list. It's about 16 pages long, and you can see we're here on these three spheres that Larry Wallace Sr. spoke about, how we're leveraging and we're partnering and engaging with the resources that are available within the community, while at the same time utilizing the funding and our involvement on that advocacy list that you have as well to really get boots on ground information as our focus within the collaboration, as you see on this next slide, is really focused on enhancing the experience, the journey, the pathway. A lot of what we're able to do through the unique MOUs that we have with all of our partners is more than just a traditional referral. It's more than just connecting someone and then you unfortunately have to wait for that individual to come back to you and tell you how that went, or let you know they don't need any further services. Because we're a clinic and we're able to have business associate agreements and other collaborations with the FQHCs, with the Mental Health Authority, with local health departments and so forth, we're able to really bridge in a way that there has been this ongoing gap even between providers in their collaborations and local organizations referring to providers. And as you can see on the slide here, what's interesting is it took 2 years in dialogue, discussion, going through legal to really establish these joint positions through community care, as well as this new joint position, the first one ever for integral care, now located with us as well. We're also, what you don't see here is also in discussions with Seton. We just brought on a health navigator to work directly within Seton to help with referrals from their emergency ERs and so forth. And so hopefully over time be able to flesh out a more structured MOU as a business associate agreement to be able to do the same thing here. Joint hiring, where we're able to, through the BMHC lens, really focus on that care coordination, navigation, growing the trust back into the system collaboratively. We're also working through discussions of creating a more formalized MOU with Austin Public Health as well. With Austin Public Health, the team has really been leveraging and utilizing back and forth between our team and Austin Public Health when it comes to community event screenings and Know Your Numbers campaign as well. This next slide that I think is very significant of importance, I don't really like to read slides, but I definitely want to read this statement on the right side, that out of over 1,400 federally qualified healthcare clinics, and community care has 29 clinics, is the largest in the nation, BMHC is the only Black men's health organization with active partnerships with FQHCs. We have a formal business associate agreement with Lone Star Circle Care and Community Care. Our physical location off of 6633 Highway 290 is identified as one of the 29 clinics under community care. So we're getting ready to go for joint certification and so forth. And as you can see from there, it says many of the organizations that advance Black men's health are not clinics, nor associated with clinics. Instead, the Black Men's Health Clinic, unlike most of them, just provide therapy and health education. So again, the way we're partnering, this different design of care coordination navigation is really providing physical, behavioral, and social determinant services on site and also into the community as well. When you look at the target population as well as the secondary population, everything focuses around the care you can trust. That is the focus here. The trust as far as you're going to be navigated, you're going to be informed of what that journey is going to look like, you're going to be informed of what paperwork and help filling out the paperwork, but at the same time, listening to the individual and what their needs are and getting them coordinated to the right service for them. And so you see in this first circle, we're intentionally with our primary client, those that are underserved, underrepresented, low to no insurance is a target population. And too often, most of the systems, individuals feel as if I'm poor, I'm getting poor services. And that's the different focus here. We're trying to make it feel as if you shouldn't have to be a VIP. You shouldn't have to be a senior leader to feel as if you're a person. And so that's really what we're trying to bring in collaboration with all of our partners, especially where our tax dollars are going into. There's a level of accountability, but in this sense, instead of pointing fingers, it's saying, how can we work collaboratively? And then with that, because of the way we're messaging, the way we're branding, that this isn't just for underserved, underrepresented, even though this is a target population, it's open to everybody. So then we're bringing in the secondary clients, the ones that want to be a part of a focused organization like this for people of color, one that's going to provide this more hands-on support and assistance where others that have financial capability usually pay for that additional hands-on concierge liaison on a quarterly basis. Where in this sense, we're actually being funded to do that for everybody. And so you see here the two tiers, but we're primarily looking and focusing on the funding that is currently going to underserved, underrepresented populations, and how are we helping the system better engage, better provide a service from an experiential point that they start using the services that we're funding them for. And then you see the behavioral, where behavioral health also connects into. What I find interesting on these numbers that I wanted to show to you is we're in 2 years of providing direct services. Last year, you see unduplicated clients. So this does not count engagements, recurring visits of clients, but this is unduplicated of last year. And then you can see so far for this year, this is only 6 months in. We've already hit about 100% of what we did unduplicated clients last year. The biggest difference and biggest change was year one, not known. Year two, more known, but we also received more funding and more support, especially through the current contract that expires this September through that council approved through Austin Public Health. And so what you can also see here, which is of interest, is even though we're tailored for the most disparaged population, Black men, is being utilized by both Black and brown. It's being utilized by other populations because it's more about the experience than just the name. When you look at the other slide next to that, what I find of interest of highlighting here is the age group. When you do a normal comparison of who Integral Care is seeing, People's Community Clinic is seeing, and others, they're usually focused for this population that our target population is usually 18 to 24, or it's more higher on the side of 55 and up. Uniquely, we are actually hitting into the population that is the population that most frequently does not want to go to the clinic, does not want to see a doctor, and then it becomes the issue when they become older. Also, when you look at the eligibility, a significant change from self-pay and private pay to this year, from almost 63% to this year, roughly 24% are self-pay and private pay. So a significant shift into reaching our actual target population. And what I would really hope you take away from this is what we're doing, even though it's labeled Black men's health care and it's for men of color, their immediate families, and those with extenuating circumstance, what we're doing and how we're going about is really systematic change that improves engagement for everybody. If we can improve the engagement for the most disparaged, it automatically improves the engagement for everybody else. And then lastly, we're also are working with various academic organizations. We intentionally, for year one and part of year two, was all about the client, engaging with the client. So a lot of the administrative stuff, we've been blessed and fortunate to get a lot of support from the academic organizations. Because we know, do we either spend a year trying to get administratively sound and have all the right things in place, and then we lose engagement with the community, or do we focus more so on the services, partnerships, and collaborations, and making sure we show immediate impact and immediate change to people's health, and then work this year and next year to really more or less structurize the best practices, the best scenario cases, so we can be able to take this, as Larry Sr. stated, to other areas within the city, with other areas within the county, because for us, it's more about just give us space. We need funding for a navigator, an outreach person, but we're tying in and connecting to services that are already being funded in the community. And with that being said, this is our board. We intentionally brought on a board that's health background experience. And our staff and team is primarily non-health. They come from different industries. They come from different backgrounds. A lot of them, 55%, come from some aspect of unhoused and homelessness. And so they're the ones that are really looking at the different services and programs that are available through our partners, our collaborators, the messaging that's happening, and saying this would never capture me, or the way this is messaged, or the pathway through this is a detractor. And so that's where a lot of the collaboration is happening, that's moving the needle that you're seeing. And with that, I turn the mic over for any questions that you all may have.
Thank you. Colleagues, any questions?
I guess I have just one question. I'm trying to look forward for y'all. What does success look like? Is it significant growth, which would suggest then there's significant need, or is it not that type of growth, and hopefully then we're meeting the needs through kind of the systems in place? I'm just curious what you see the future success look like for you.
So for me, success, number one, looks like we can measure our result. What's the outcomes? What change are we making? And once we can identify, quantify, and be able to state those changes, it's a journey. And so at what point in the journey can we look and say we made progress? We avoided ER admissions. We avoided people going into the hospital. We were able to change the pathway of chronic disease management and had an influence on the health status. So for me, that's success. But beyond that, yes, we've been really approached by many communities about our work and would like for us to expand. And we're a small team, and we can only go as far as our funding allows. But success is when folks can look at our organization and say, if you want to reach African American men and Latino men, because over half of our clients are Latino. And so if you want to reach that population, success to me is come to us. We have the data, we have the know-how, we've done all the research. You don't have to do it. Rely on us as the agency to make that happen for you.
You know, for me, it's almost dualistically, right? One, definitely tying into what Larry Wallace Sr. stated, which is, and we're having this ongoing conversation even with community care and central health, that what we're focused on as this collaborative effort of improving the system and how it engages. How do you measure the engagement piece? How many touches and so forth to build this trust to where now we have our director of care coordination and navigation. There are certain patients that will not schedule an appointment unless she's on the phone with them, just to give that sense of it's good, right? How do you measure that? Because oftentimes it's being measured by how many people actually show up for an appointment and the no-show rate. but what's actually getting them to even come up to experience the first no-show rate to actually experience and go through the process. Most of our individuals are being enrolled in MAP for the first time. Some are coming through different avenues. Our diversion program that we started with Austin Echo, that year 2, y'all did an amendment for us when those funds went out to carve some funding out for unhoused and client assistance, right? So we're able to bring people in through that door that others are not able to, and say, hey, you also have to sign up to be a client and set up a basic assessment of your mental and physical state. We have individuals that are coming through our barbershop program where they get $25 off, which is basically the copay they're paying to come see a doctor. And so how do we capture those things of demonstrating this impact in the community, partnering with youth sports organizations, non-school aids, where they don't do physicals, they don't do numbers for the kids, and we're bringing that through a lot with the collaboration with Austin Public Health and men's sports areas. We're looking at a discussion with the YMCA now to bring screenings for their organizations and stuff at the North Austin and the East communities and so forth. So it's one is better being able to capture that usually, because of the way funding is to FQHCs and the mental health authorities and so forth, are more behind the seats and no-show rates than the engagement, the trust building that we're focusing on behalf of our partners. And then the other piece is now the growth that is happening, being asked to come into Community First, being asked to launch our satellite location in Pflugerville on the 29th with Abundant Life Church, being asked to come into these other places, but maintaining the quality of engagement and hands-on time. I don't want to say time consuming in a negative way, but the time that's needed that we've lost sometimes by going too technical and more expecting people to do the research, go to the website, than actually taking the time out to go through these processes with them. That's what we're taking on. And I think to be successful with the natural growth that is happening, more funding is going to be needed for bodies, to bring on the bodies.
Well, thank you very much. Appreciate the work y'all are doing.
Thank you. And just to build off of your comments, one thing I was going to ask about is the BMHC's work related to our unhoused population. You mentioned that there was some work that y'all did with ECHO. How are y'all plugged in, or to what extent is outreach done with our unhoused population? Do you foresee any opportunities where we could further integrate BMHC with our unhoused?
Several opportunities. Honestly, we just had a meeting with Dr. Patrick Lee over at Central Health CEO last week. He also mentioned the same thing as well. We'll be doing a follow-up with his team in their efforts regarding that space as well. I'll tell you what we currently have going on and some discussions that have been going on. Currently, we do have an individual that basically oversees unhoused and diversion efforts. She's going out into the encampments and so forth. I would say 41 plus individuals have been taken care of with roughly $32,000 because she's working with other partners and collaborators to bring the cost down, exemption of fees. Individuals are getting plugged into partnerships like Goodwill and others. We've done funding of bodies, but we had to pull that back because of funding restrictions. We did fund bodies to be embedded with Queertopia, to be embedded with Hungry Hill Foundation. We've tried to figure out how we support other organizations like Walking by Faith Ministries and Jail to Jobs. So more funding in those aspects to bring bodies on. We can intentionally ramp up that, but we also want to, for however many bodies we bring on, still be able to have a restricted funding account for diversion, for client assistance. Because even if someone may be MAP 150 or so forth and they have to pay a small copay, sometimes they still can't even pay that. We've supported in purchasing the glasses, the prescriptions, and so forth. And again, coming out into Community First. So that's going to be a new area. So how do we be able to grow into a dedicated person into those spaces, right? We've been having the conversations with Austin Echo and the PSH collaboration that's going on. in potentially being involved in that effort as that conduit of who's engaging with those individuals on the more day-to-day basis. So that way, if there's changes or needs within the physical and the behavioral health, we're there to be able to make those phone calls and say, hey, instead of coming out next week, this individual needs to see you tomorrow. This individual needs to see you today and whatnot. So there are conversations going on, but like anything else, a lot of it is kind of restricted on funding availability. A lot of it on our end is restricted on being able to bring someone else on and not have them be concerned about job security.
I mean, I just think it's healthcare services in general is a preventative measure for folks at risk of falling into homelessness. I had one conversation with an unhoused neighbor who talked to me about he needed cataract surgery, was unable to navigate the healthcare system, didn't get his much needed eye surgery, lost his job as a result of it, lost his house as a result of it, and has been living now 3 years in one of our parks. And so I think that, and you can count on my continued support for this level of service, the programs that y'all offer at BMHC. I think it's so important for our community, and I thank you all and appreciate the work that y'all are doing for our Black and Brown community, and would like to see further investment.